Hello everyone, in this video I am going to discuss about the anatomy of female breast. Female breast overlies second to sixth rib, as you can see here, second to sixth rib, and 2/3 of it rest on pectoralis major muscle and 1/3 lies on serratus anterior muscle. Its lower medial edge just overlaps the upper part of the rectus sheath. Here the ribs are there, and you have the pectoralis major muscle here and pectoralis minor muscle here. Here you have the deep fascia over the pectoralis major muscle, and here you have the superficial fascia and then the skin. So the breast lies in between superficial fascia and deep fascia. Here you can see the Cooper's ligaments or suspensory ligaments, and here the yellow color one is the subcutaneous fat, and here you have the lactiferous sinuses, here the breast lobules. When we talk about the structure of the breast, it is made up of 15 to 20 lobules of glandular tissue. It is made up of 15 to 20 lobules of glandular tissue, and it is embedded in fat, superficial fat. This fatty tissue which surrounds the glandular tissue is responsible for the smooth contour and most of its bulk. This fatty tissue is responsible for its contour and the bulk of the breast. The lobules of the breast are separated by fibrous septae which runs from the subcutaneous tissue to the fascia of the chest wall. Those fibrous septae runs from the subcutaneous tissue to the fascia of the chest wall. We call them as ligaments of Cooper. Here you can see the lobules of the breast. Here the nipple and it surrounds the areola. Here the milk duct is there. Here you can see the lobules drain into lactiferous sinus here. Here the lactiferous sinus. So the each lobule drains to its lactiferous duct and thereby into the nipple. The nipple is surrounded by areola which is pigmented. Usually in girls or before pregnancy, it is somewhat brownish of fair brownish in color, but after pregnancy the areola becomes darker in color. This area is lubricated by areola glands of Montgomery. This area in the areola, you have the glands called Montgomery. Those Montgomery glands are modified sebaceous glands. Those Montgomery glands are modified sebaceous glands. But the female breast, we call it as modified sweat gland. Breast is a modified sweat gland, while those Montgomery glands in the areola are called as modified sebaceous glands. Sometimes those sebaceous glands can form cysts, and sometimes they can be infected. You have to remember that the major part of the breast is situated in the superficial fascia. That is important. But there is a small part which is called as axillary tail. Like in this area, it is called axillary tail, and it extends upward and laterally. Axillary tail extends upward and laterally and pierces the deep fascia at the lower border of the pectoralis major muscle and enters into the axilla. What happens to this axillary tail? It extends upward and laterally, and it pierces the deep fascia at the lower border of the pectoralis major muscle, and then it enters into axilla. So that part is in the deep fascia. Here in this picture you can see very clearly the fibrous septae which separates the lobules here, and this is the nipple, and it is surrounded by the areola. This is the axillary tail which is in the deep fascia, This is the major part of the breast, which is in the superficial fascia. Here again the ribs and the intercostal muscles. Here the pectoralis minor muscle. Here the pectoralis major muscle. Here in this diagram you can see there is a space. We call this space as retromammary space. This space is retromammary space. This retromammary space is filled with loose areolar tissue. Here you can see the fibrous septae, or we call them as suspensory ligaments. Here the lactiferous ducts and the lactiferous sinus here. Then lactiferous sinus drains into the nipple. When we talk about the blood supply to the breast, it is from axillary artery. The branches coming from the axillary artery. Here is the axillary artery. Here one branch which is coming from the axillary artery. It is lateral thoracic artery here. Then here there is thoracoacromial trunk, or we call it as acromiothoracic trunk as well. This also send branches to this breast tissue. And here in the medial side you have the internal thoracic artery. The branches from the internal thoracic artery is also supplies to the breast. 2 to 4. There are perforating branches which arise from the internal thoracic artery. The perforating branches are the branches gives into the first to fourth intercostal spaces. Those perforating branches first pierce intercostal spaces and then traverse pectoralis major muscle to reach the breast along its medial edge, as you can see here. The first and second perforating branches are the largest branches from the perforating branches. Then some branches which is arise from the intercostal arteries are also supplies to the breast. When we talk about the lymphatic drainage of the breast, it is the most important part, because when there are tumors, or when there is a breast carcinoma, it is spread mostly via this lymphatic drainage. Approximately 75% of the total lymphatic drainage of the breast drains via the tributaries of the axillary vessels to the axillary lymph nodes. Some amount of lymphatic drain along the tributaries of the internal thoracic vessels, as you can see here, piercing the pectoralis major muscle to traverse the intercostal spaces to lymph nodes along the internal thoracic chain. Here the lymph nodes in the internal thoracic chain. When we talk about the anatomy of the breast can also be divided into 4 parts or 4 quadrants as upper lateral quadrant, lower lateral quadrant, then upper medial quadrant and lower medial quadrant. So if we talk about the lymph drainage quadrant wise, the lateral quadrants of the breast drains into the anterior axillary or pectoral group of nodes, which is situated along the lower border of the pectoralis minor muscle. The medial quadrants of the breast, the lymph drainage from the medial quadrants of the breast drains into the internal thoracic group of nodes, as I told you previously. Then we will move on to the clinical part of the breast. That means we have to discuss about the features that we can see during breast carcinoma. One feature is peat orange appearance. That means if there is a carcinoma, you can see the breast as the outer layer of the orange or orange peel. We call it as peat orange appearance. Here you can see it is mainly due to lymphedema, and also here you can see dimpling of the skin. Here there are dimpling of the skin. This dimpling of the skin is due to malignant infiltration and the fibrous contraction of the Cooper's ligaments. These dimplings are due to malignant infiltrations and fibrous contractions of the Cooper's ligaments. As they pass from the superficial fascia or from the skin to the deep fascia, their shortening results in tethering of the skin to the underlying tumor. So from this picture you can see the pedo-range appearance of the breast as well as the dimpling of the skin. Here you can see somewhat there is a nipple retraction. Here clearly you can see the nipple retraction. It is due to involvement of the milk ducts in fibrous contractions due to tumor. And also one other thing, in a breast examination you have to squeeze the breast and look whether any secretion coming from the nipple. That can be bloody stain if there is a carcinoma. When removing a breast tumor, we do radial incision. As you can see here, we do this radial incision, or sometimes we do simple mastectomy if it is a less extensive one. If there is a large tumor, we do extended simple mastectomy. In extended simple mastectomy, what we do is we clear the axillary fat and the axillary lymph nodes as well. In extended simple mastectomy, we clear the axillary fat as well as the axillary lymph nodes in it with the breast. So those are the important points that you have to know regarding the breast anatomy and about the breast carcinoma. So thank you for watching. If you like my video, please subscribe and like my video.